This is Focus on Your Health on the KJAZ Radio Network. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and this week my guest is Dr. Ryan Swapp. He's a pathologist and medical director of the laboratory at KRMC. Dr. Ryan Swapp, welcome.
Thank you. Great to be here.
I'm glad you're here. We're kind of showing up late to the Ebola party. Has the fervor died down a little bit?
I think so. I get the Wall Street Journal every day, and it seemed like for days and days that was the thing on the cover, and now it's kind of buried in Section C.
Right.
So I think so. I think some of the hysteria has kind of calmed down.
Hysteria is the perfect word for that. When this whole thing kicked off, and I think it was about March that it was really starting to flare up in West Africa. Does that sound right?
Yeah. That's fair.
Sierra Leone and help me out, Guinea.
Yeah.
Right.
Guinea, West Africa. Yeah.
And I thought at that point, well, that would be an interesting show. I should see if there's someone around who'd like to speak with me about Ebola.
Uh-huh.
And then it hit the U.S., and then suddenly the media circus began.
Yeah.
And I have to say, what a bunch of cretins. I just hate the media. And I think the public needs to know, certainly the public needs to know, and there's a discussion, but then it reminded me a lot of, just after September 11th, where every local donut shop was having a ricin attack or an anthrax attack.
Right.
It turns out somebody just spilled the sugar or the sweetener or something like that.
Right.
Pretty despicable. And
it's a lot of wasted energy. And there are some good sources of information out there, but it didn't seem like a lot of the things I was hearing were really that
particularly valuable. Yeah. There's a line between getting that information out and that classic, will Ebola descend on your child's middle school?
Right.
With details at 11.
Yeah, well, Ebola is a scary thing. Without being hysterical myself about this, I remember being a microbiology major in college and reading Richard Preston's novel, which it's based on some facts, but it really is fiction, called The Hot Zone.
Right.
And he also wrote another one called, I think it was called The Demon in the Freezer or something like that. And it's been a long time since we've had a pandemic. It's been a good 100 years or so, and so we have air travel and that kind of thing. It is a scary proposition.
The world has certainly gotten smaller.
Absolutely.
Right, and if there's something going on basically anywhere in the planet, there's a good chance it could show up here.
Right.
Even here, right?
Yeah.
We're talking about a major crossroads. You're going to stop here on your way to LA. By the way, we have tourists from all over the world coming to northern Arizona.
Yeah.
So anything could happen. Let's try to shine a little bit of rationality on the thing. Scientists have been able to trace the first case of Ebola back to 1976. Is that correct?
Yeah, that's right.
So tell me a little bit about the story.
Well, no one exactly knows how the first person contracted it. There are all kinds of hypotheses. But what is known about Ebola is that, Ebola is it's a virus, and the way that we classify viruses, just to go on a bit of a tangent here, is based on what their genetic material is, and then also whether or not that genetic material is single-stranded or double-stranded. So this is single-stranded RNA, and it inhabits primates. It's found there's 5 different families of Ebola. The kind of Ebola that we're talking about can infect primates, and it's known to be found in apes, gorillas, and so it was found in, I believe it was Republic of Congo or Zaire, and what probably happened was someone had contact with an ape, maybe an ape that was dead, or a bird. It's also the fruit bats are a known vector.
Okay. We should define the term vector. They're carriers, essentially.
Essentially, yeah.
Okay.
So a vector is something that isn't necessarily going to die from the disease itself, but carries it.
Okay.
So, for example, I guess one of the most famous vectors, when you think about human plague,
right,
and of the Middle Ages, and you have basically a flea that is hanging out on a rat, and that flea is the vector to the humans.
Okay.
So the flea, was just kind of carrying that around, and there's not been a lot of work done about fruit bats, and even some of that is kind of postulated.
Okay.
But that's a vector of Ebola.
You talked about 5 families of Ebola. Could each of those infect human beings?
So 4 of the 5 infect human beings, and the other one is not known to infect human beings. It's part of a general family of viruses called hemorrhagic viruses in the Marburg family. There really hasn't been a lot of work done on these viruses, and even now, even with this outbreak, you probably have heard that with treatments we still don't really know. We treat them as best we can, but you can't do randomized controlled trials on.
Is it essentially support? We're kind of getting ahead of ourselves here, but is it essentially supportive care for this?
Essentially, they've also kind of used passive immunity, and that is to say, there have been a few patients who've survived Ebola, and so they have long-term immunity, and their immune systems are generating IgG antibodies, and so they take the serum from those people, and if they're compatible, then they could transfuse these patients with someone who's been healed with their serum, essentially.
So we think that we've traced it back to the mid-70s.
Right.
So is it possible then that there were outbreaks before then, or like on a smaller scale, that weren't known? Or
Yeah, absolutely.
Yeah.
I mean, I've never been there, but I guess I can imagine that the Republic of Congo was a pretty remote place, right? And so
probably minimal medical standards and hygiene standards,
right? I mean, they aren't doing a whole lot of epidemiology there, I imagine.
Of course,
especially in the 70s, and certainly not before that. And so, absolutely, I mean, this probably just didn't spring up overnight.
Okay.
I mean, these viruses and really all living things, including bacteria and viruses, are constantly mutating their DNA, and sometimes it works and sometimes it doesn't, and those advantageous mutations have a way of manifesting themselves.
Help me to understand. So there are these periodic outbreaks where thousands of people will die.
Yeah.
But then things seem to go quiet.
Mm-hmm.
What's going on in that time? Why is that? It's just that it's not flared up. The vectors are still out there carrying it, but how can I understand this?
Yeah, so I'm not exactly an epidemiologist, but I guess from what I know about epidemiology, these things are not arithmetic in nature, right? I mean, these things tend to peak very quickly. And so, I mean, this is a graph that looks, very steep. That's simply because it is so infectious. So, I mean, that's probably the biggest thing. It's probably sometimes what happens in these situations is you have an event which would maybe increase the vector, or, in this case, I don't know what would happen so that a fruit bat, the fruit bat population would just get multiply.
Okay.
And I don't think that that's really what anybody's surmising.
Right.
But it's mostly human-to-human contact.
Okay.
Some of the biggest problems are with healthcare workers.
Yeah.
As we saw here in the United States when all of that scare was going on a few weeks ago.
Yeah.
A patient gets sick, they realize maybe they go to a center where they're supposed to be cared for, but the center may not have everything that they need to keep everyone safe, and the healthcare workers actually are at really high risk for contracting the disease. And that's really what's happening. The healthcare workers leave. The incubation period is longer than just a few hours, and so they go home, they feel fine. There's a prodromal period
Which means what?
Well, it basically means that you've got the virus. The virus is starting to multiply, and you're starting to feel a little bit sick, but you don't feel that it hasn't manifested itself completely yet. Mm-hmm. So what happens with Ebola is the virus gets into your cells and basically starts from that RNA that it has, which is its genetic material, starts making messenger RNA, which then make proteins. And, they make several of these, several hundreds to thousands in your cells, and then those cells explode, and then they go on. And so you can see how that could move very rapidly.
Right, sure.
And so that's really the prodromal phase. So healthcare workers who may be infected pass on to someone else, and then you can see how that can multiply really quickly.
Right. Do the typical PPE or personal protective equipment, right, those measures for a physician, I can only guess about in Africa, but even here, right? So you're talking rubber gloves, you've got probably a surgeon's mask, right? You've got glasses.
You have a face shield. So, it's really all encompassing. And, as you said, you have gloves, you have some kind of maybe a bunny suit, or
it's more like a hazmat suit,
right? Basically a hazmat suit, yeah,
all right, essentially.
And then you'll have a face shield as well, and it's actually more than a surgeon's mask. It's a mask that has an N95 filter.
Oh, okay.
So it's going to collect those particles. Some masks, won't have that kind of density to it to capture those particles. And the hardest part is actually with that kind of equipment, it's not so much like putting it on. I mean, it's fairly easy to put it on right, but the hardest part is not contaminating yourself when you take it off.
Trying to get out of it.
Yeah, I mean, it's easy to flip something onto something else, and you're trying to do all this while you still have your gloved hands, and then you try to take your gloves off in a way such that you don't. When they deal with these things in like bio-level 3 and 4 laboratories, they take extra precautions, and there's an extra room between where you're working and showers and all of that stuff. So.
Right. Whereas I imagine if you're in some village, they must have had significantly reduced personal protection.
Yeah, just reading some of the stories that are out there, it seems like they typically, they may not have all of the PPE that they need.
Right.
It's a difficult situation. It's tough for everybody.
Would you say with the bunny suit, the risk is still substantial for a healthcare worker?
Not really. Most of the places where you're going to contract it are really going to be, around the face. So, if you somehow got splashed, in the eye or in your mouth or nose, that's really where you're most vulnerable. Mm-hmm. The other thing that you need to be careful about that we're always, worried about are needle sticks.
Right.
But even with, I think that a lot of that can be mitigated just following basic rules and protocols. But, when people get excited, they don't follow protocol, and occasionally somebody gets stuck.
It's time for a quick break on Focus on Your Health. We'll be back with the rest of my conversation with Dr. Ryan Swapp in just a moment. This is the KJazz Radio Network. Welcome back to Focus on Your Health on the KJazz Radio Network. I'm TG LaFredo, and this week I'm speaking with Dr. Ryan Swapp, pathologist and medical director of the laboratory at Kingman Regional Medical Center. Tell me about transmission of Ebola.
Well, this has actually been something that's been a bit of a controversy. I think maybe the public has felt like those in authority haven't been completely truthful with them about transmission. They talk about it like in the same vein as HIV, human immunodeficiency virus. It can be transmitted through droplets, and so if someone were to sneeze, that certainly sends out droplets, and I think that's something that we don't really have any good data on that, whether or not that would transmit virus or not. But I think that I certainly would be worried about
It seems
that myself.
plausible.
Yeah,
Yeah.
absolutely.
Okay.
But other than that, they talk about body fluids, and that's essentially what everyone at this point believes. And so unless you have direct contact with someone's body fluid, which I guess could include droplets, and that's really, that whole droplet thing has been really the point of friction. If you have body fluid contact with a mucosal surface, such as, like your mouth or
Right.
your nose or your eyes or something like that, that's, I think, what everyone is really worried about.
Right. In terms of treatment for these patients, we talked a little bit. It's mainly supportive care.
Mm-hmm.
The odds of survival are not so good.
Mortality has been a little bit different in different outbreaks, but it ranges anywhere from like 40 to 70%.
Yeah.
Also, it depends on how you do the numbers, because you don't test every patient who has Ebola, and so I think the last numbers that I looked at, which was maybe a week or two ago, was just under 50% mortality for patients who had been tested for it.
And that, I think the subtext is it wipes them out, some of them, so fast that there's no test to be done. Or
That's true, and that is also true. But I mean, there are some, there are many patients who in Africa are not going to have, these laboratory tests performed on them, but clinically look like they have Ebola.
Right.
And so some of those numbers go up when you factor that in. In previous outbreaks, I think it's been somewhere close to 70%, although don't hold me to that.
When we're talking about that kind of incubation period, when it initially happens with a patient, what are the symptoms that you tend to see?
Well, I think that's what makes it really difficult, is they're very nonspecific symptoms. So it's like headache, malaise, which is a feeling, just generally feeling not very good, a cough, body aching, myalgias, things of that nature. So they're very nonspecific things, and it doesn't until you start bleeding from mucosal surfaces, it doesn't really manifest itself.
Right. My wife, who's a pediatrician, she takes call at home.
Yeah.
And I overheard her talking to a mother. You can see where this is going to go.
Right. Yeah.
The mother was not in a panic, but I overheard, and she was like, "Oh, okay, fever, a little bit of soreness."
Yeah.
Like, okay, well, ergo, it could only be Ebola.
Yeah.
And that's really, it's a particular problem with this because of, as you say, the nonspecific symptoms.
Yeah.
It could push you into freak out mode.
I don't know what it is with, and it seems like it's kind of in vogue these days to, like the apocalyptic world, like with The Walking Dead and, whatever else.
That's right. This fits right with that, doesn't it?
Yeah, I mean, and I think also there's, in the West, there are also just a lot of kind of isolationists.
Yeah, we talk about them from time to time.
Yeah.
Like people, we reach them.
Yeah.
Conceivably they're listening, and they think that you, as a physician, are part of this big cabal. You are one of them, and we are,
Right. I hear what you're saying.
Any sort of authority, anybody who knows anything.
Right. Well, I mean, I think that there are fears that I think everyone has that are reasonable.
Yeah.
And certainly, history is ripe with examples of abuse of power and withholding information, lack of transparency, and so that's certainly reasonable.
Yeah.
I think though that for the most part, the CDC's been pretty transparent, and it's nice to live in an age of transparency, more or less. I think their website has excellent information.
Yeah.
I mean, after all, they really are the experts on this. So
I think of that cliche about how the best disinfectant is sunlight, or sunlight is the best disinfectant.
Right.
And I think there's so much media. And by that I mean also the things that you and I can create and post. And it's a lot harder to keep secrets these days.
Yeah, absolutely.
Right? If something's going on, even if you could control the traditional channels that would put that information out, it's not going to stay secret for very long.
No.
We've seen that with revolutions around the country, around the world.
Yeah,
right?
Absolutely. I mean, there have been a lot of examples of, Facebook, Twitter, and all of those things, organizing. But I mean, it happened here just the other night. it was a very unfortunate situation where a house here in town caught on fire, and I could see it, from my house. I was out playing with my kids, and so I just flipped up my Facebook feed, and you could see who what had happened, literally in minutes.
Right.
So that it has really changed everything.
It has, and there are pros and cons to it, because also that paranoia and mania can spread a lot faster.
Right.
It's like conflagration.
Absolutely.
All right. Now, if you had to take some international flight or had to do, would you be concerned at all at this point?
So it's funny you mentioned that, because my wife's actually headed to Atlanta next week.
Okay. Yeah.
So, Atlanta is one of the.
It's a major hub.
Yeah, exactly. The CDC is in Atlanta. So
right.
I'm not really that worried about it, to be honest. At this point, I think, it's pretty safe to travel. And there was a lot of kind of grandstanding about this with the governors of New Jersey and New York and the federal government a couple of weeks ago. Mm-hmm. It's interesting, it's kind of fun to read about, but I think the government took a reasonably prudent approach to this. So I'm not worried about it at this point. No.
I'm flying to Dallas, which is also,
in
fact, that was where
That's funny. My partner's actually headed to Dallas as we speak.
Okay.
So
he's not worried either.
I told him we're going to put him in quarantine before he comes back to work.
What would happen if by chance, let's look really locally here. Mm-hmm. What would happen if by chance someone showed up at the ER and said, "Oh, I have Ebola"? I think sometimes people just do this stuff, like they say it in court to freak everybody out, or they say it at the airport. So, let's just say, what if this happened?
Yeah, it's a good question. So we've actually, as soon as this started coming out, our chief medical officer started, talking about this along with our infection control. And basically, the government has kind of laid out how we should go about this. But the short answer is basically that person would be put in isolation. We have a place designated where we would put them, put them in a room that has controlled ventilation system. And then anyone going in or out of the room, would be fully equipped with PPE. It would be limited to a few people, and those people have already been designated. So it's not like anyone would just be thrown into that very uncomfortable situation. You can imagine that, your employer says that you need to go take care of this patient.
Yeah. Imagine there are some providers who will not sign up for that job.
Yeah, absolutely. And there have been some who are comfortable with that. And so we would limit that to a few people and then try to stabilize that patient and send them to one of the treatment centers as soon as possible.
There are select treatment centers nationally. Is that the story?
Yeah, last I checked, I think there were 4, but that may have changed.
Right.
Yeah.
Things now seem to be calming down. Is it safe to say that at any given time there are people on the planet who have Ebola? Or is there going to be a point then when things calm down where it's just sort of latent? It's just with those vectors and not in the human species?
I think that it's probably safe to say that at most times there's probably someone with Ebola. If you look at the CDC's timeline, they have a great graph of when it started and then year by year kind of when the outbreaks happened and where they happened. And there have been a lot of really small outbreaks, and if that's true, then there's probably there's the phenomenon of underreporting probably, and so I think it's probably safe to say that much of the time someone probably is infected, and then probably the rest of the time it's kind of smoldering. That's kind of the term that epidemiologists use.
That's Dr. Ryan Swapp, pathologist and medical director of the laboratory at Kingman Regional Medical Center. Dr. Swapp, thanks so much for joining me.
It's been a pleasure.
And that's this week's show. I'm T.G. LaFredo. Thank you for listening. And please join me again next Saturday at 11:30 a.m. for another edition of Focus on Your Health, right here on the KJazz Radio Network.